Is your memory not as sharp as it used to be? Do you feel a sense of mental cloudiness that makes everyday tasks harder to complete? You are not alone. Today, we are diving deep into brain fog in seniors, what it really is, why it is so common as we age, and the crucial differences between brain fog and dementia. Stay tuned because in the next few minutes, we will also explore science-backed ways to combat brain fog and boost your mental clarity. As we age, our brains undergo natural changes. Some of these changes are normal, while others can make daily life more challenging. One of the most common complaints among older adults is something often referred to as brain fog. But what exactly is it? Is it something we should be worried about? Or is it just a normal part of aging? Brain fog isn't an official medical term, but it's a common way to describe feelings of mental cloudiness. Those who experience it often report having trouble concentrating, remembering details, or feeling like their brain is operating in a fog. But why does it happen? First, we need to understand how aging affects the brain. As we get older, brain volume decreases, particularly in areas like the hippocampus, which is critical for memory and learning. This natural shrinkage can lead to slower processing speeds and less mental clarity. Studies have shown that after age 50, brain volume decreases at an average rate of 0.2% per year. This gradual loss can affect cognitive functions, leading to what we now know as brain fog. But what makes brain fog different from something more serious like dementia? And why is it so common in seniors? Let's discuss that next. Let's set the record straight. Brain fog is not dementia. While both can involve memory issues, the key difference lies in the severity and progression. Brain fog is temporary, usually linked to factors like sleep deprivation, stress, or lack of stimulation, and it can often be reversed with lifestyle changes. Dementia, on the other hand, is a degenerative condition that impacts memory, thinking, and daily function in a much more severe way. Conditions like Alzheimer's disease are examples of dementia, and they tend to worsen over time. So, if brain fog is common but not necessarily a sign of something as serious as dementia, how can we prevent it? Well, there is age-old wisdom that has stood the test of time. But more importantly, scientific studies back these simple lifestyle changes. Now, stay with me for the next few minutes as I reveal these preventive strategies. 1. Use it or lose it. You have probably heard the saying, use it or lose it. This applies directly to our brains. Staying mentally engaged is one of the best ways to keep cognitive function sharp as we age. Engaging in activities like memory, games, reading, and even learning new skills can help your brain form new neural connections. For example, studies have shown that seniors who engaged in regular cognitive activities had a lower risk of developing dementia. If you are wondering how to start, just pick up a new hobby, whether it's learning a language or trying out a musical instrument. Even something as simple as doing crossword puzzles or writing can help. 2. Stay socially active. Another powerful strategy is to stay socially engaged. Research consistently shows that regular social interaction can actually improve cognitive function. Guess what? Simple conversations help stimulate memory and problem-solving skills. Seniors who are isolated or have limited social contacts are at a higher risk of cognitive decline, as recently revealed in a study published in the Canadian Journal of Aging, which showed that people with strong social networks are 60% less likely to develop dementia than those who are isolated. So, don't be afraid to make that phone call to your loved ones or join a local group. 3. Eat right for your brain. Eating a brain-healthy diet is another age-old wisdom that's backed by science. Foods rich in omega-3 fatty acids like salmon, walnuts, and flax seeds support brain function. Omega-3s are essential for brain health and are known to boost cognitive performance. We now know that seniors with higher omega-3 intake had better cognitive function and less memory decline. On the flip side, we should be reducing sugar intake, as higher sugar consumption is linked to impaired memory and cognitive decline. So, focus on a balanced diet rich in vegetables, whole grains, and healthy fats. So far, we've discussed some great ways to improve cognitive function, but you might be wondering, how do you apply these strategies on a daily basis? I've got some practical tips to help you create a lifestyle that works. One simple but powerful strategy is to use reminders. As we age, it's natural to need a little more help with memory. Tools like calendars, checklists, and even smartphone apps can help seniors stay on track with daily tasks and medication. Associating certain activities with existing habits, like taking your vitamins after breakfast, can also make them easier to remember. Now, let me lay this out for you. Why brain fog is common among seniors is not something we have to just accept. By staying mentally and socially active, eating a brain-healthy diet, and using simple tools to stay organized, we can significantly reduce the impact of brain fog. And best of all, these strategies are supported by science and age-old wisdom alike. Remember, as a practicing physician, I have seen firsthand how small lifestyle changes can have a profound impact on brain health. Taking care of your brain isn't just about avoiding cognitive decline, it's about living life to its fullest at every age. So, take that first step today. If you found this video helpful, don't forget to like, share, and subscribe. Let's keep the conversation going. Drop your thoughts or questions in the comments below, and hope to see you in the next video.